Hi everyone, Adam here again from Kinetics Physiotherapy, continuing my series on patellofemoral joint pain, but this time we're going to be looking at taping. So with patellofemoral joint pain, the most important thing is the exercises. I covered these in a previous video. They'll work to strengthen the inside of the knee, this VMO muscle here, and also the outside of the hip to try and sort of stabilize this knee and get this kneecap tracking up and down correctly like we need it to, which unfortunately isn't the case with patellofemoral joint pain. So when we're looking at taping, essentially we want to try and support this kneecap further by applying some tape to the area to help support it and make sure it tracks up and down a bit more correctly. So I'm going to try and tape my knee and show you and do like a follow along video so that you can do it at home and see if it helps. It doesn't work for everyone unfortunately, but you're not going to cause any problems to the knee. So if you want to try it, go for it and then try and see if it relieves your pain. It's not going to be a long-term strategy to try and resolve this pain. At the end of the day, you can put as much tape on it as you like, but you're not going to solve the strength issues and improve the strength on the inside of the knee and the hip. But if it can reduce the pain and allow you to get through the day at work, or can allow you to compete and do a race that you wanted to do, or whatever it is that you want to do, or even just get through the daily tasks, it's a good way of managing it and reducing the pain levels down, similar to taking sort of paracetamol or any sort of pain relief. It's just another method of that. So as always, I am a physiotherapist, but I don't know who's watching this, so before you start whacking any tape on your knee or thinking that it might help, go and see somebody. Go and see a doctor, GP, physiotherapist. They'll be able to have a look, assess your knee, make sure that that is the problem, and then give you some guidance as well. But if you know that's the problem and you want to give it a go, give this a follow-on. So I've got here my roll of tape, a pair of scissors. You don't need any specific scissors. I'm using K tape as well. Again, not a specific brand. So what I would suggest when you're doing these, so yeah, scissors, you can get the safety scissors. They're more just so that when you're rummaging around in your bag and you're not looking, you don't hurt yourself. I'm just using a pair of kitchen scissors. It doesn't matter which ones you use. So when we're looking at measuring the tape, so I'm going to use two sort of lengths of tape. There's quite a few different techniques, but this is the one I found personally that helps me the best, or I found the best results with. Now you get whoever you're taping sitting in a chair. You want the knee bent to start with. And then the kneecap, if you sort of put your hand on your thigh and just run your hand down your thigh, you should feel the bony bit just around where the knee bends, and that's your kneecap. So if you put your finger on the kneecap, or a couple of fingers here, and then you go just off the end, you should feel a spongy bit, and then go a bit further, and then it should be a hard bit, sort of like a lump here. So what we're going to use is our starting sort of reference point. So what you want to do, get your tape, put one end on that bony bit, that's your starting point. And then you roughly want to sort of guide it round, because we're going to have two bits that go almost like in a V, or if they're too long, maybe in an eyelet shape, up to just roughly where the top of the kneecap is. So I'm going to go to about here. So you can see how I've measured that there. Just put my thumb there, just as a reference point. Get your scissors, and then just cut straight across. And then drop it on the floor. So you want two bits of tape, roughly similar size. So I'm just measuring them up together. And it doesn't have to be 100% the same. There can be some variation, that's absolutely fine. So put your two bits of tape, and then what I like to do as well, because you can leave K tape on generally for 2 or 3 days. And the K is kinesiology tape, so if you do try and search it, in fact I'll leave a link below to the tape that I'm using, so that if you want to get the same one, then you can do. But essentially what I like to do when I'm using any sort of tape is just round off the edges here. So when you're wearing it, say for example it was cold outside and I went to go wear some tracksuit bottoms, if you've got the some rounded edges, it's less likely to peel up and get caught on clothing, so you just wear it that bit longer really. And you can generally keep it on for 2 or 3 days. The main thing is that you, when it comes to washing, so you can shower in it, it'll stick to you, but don't rub it dry. When you're drying yourself and you're using a towel, just dab it dry, otherwise it will come off. So just rounding these edges here, making a right mess on the floor, and then get to applying it. So last couple of edges here. Again, it doesn't have to be exact, just making sure it's not a point here. So as you can see, sort of these rounded edges here. Put the scissors to one side. So, when we're applying it here, generally speaking, I'll apply the outside bit of tape first, because what you find with the kneecap tracking up and down, often it's more deviation out towards the outside of the knee, just because when we're looking at that knuckle where the kneecap sits in the middle, the outer side of it is just a little bit shallower, so it's less, it's not providing as much support. So I generally do this side first. And what I'll do is where you've got your curved edges, just fold that over there, and then just use that as a line to tear along, like so. So I've got the rest of the paper still on, it's just that end bit that I've exposed. Find that bony bit just below your kneecap here, and then stick that bit you've exposed right on that bony bit, facing out to the side a little bit, because they're going to go around like this. Give it a little bit of a rub, make sure it's nice and on there. So you'll find that someone like myself who's got hairier legs doesn't stick quite as well, so just make sure you rub it afterwards to make sure it sticks to the skin. So what I'm doing here, I'm just putting my finger on this anchor point here to make sure it stays there, and then I'm going to peel off the rest of this, except for around a similar size bit just on the end. I'm going to fold that back to get a good hold on it. Put your finger on the anchor point, make sure it doesn't move, and then what we're going to do is apply a stretch. So you're going to pull this tape so it's nice and stretched, and then almost cut round the kneecap here to the end here, and then the last bit, just take the stretch off. Okay? And then give it a good rub, just because then it warms up, sort of almost gel on the back of the tape to make sure it sticks to the knee. Just give it a good rub. Okay, so that's the first bit, and then the second bit, I put just behind me here, we're going to do pretty much exactly the same. So fold over this first bit, and then just break it roughly along here. And then just stick that first bit. You're going to overlap it here, so again on that lumpy bit here, just below the kneecap. It'll overlap a little bit, but that's okay. Just make sure that anchor point's stuck down there. And then get the rest. Peel it back, get a good grip on it. Secure that anchor point with your fingers there, just hold it. Give it a stretch. Again, cup the kneecap, so mine are a little bit long, so it's going to make more of an eyelet type shape, but that's absolutely fine. Then just give it a good rub. Just be careful when you're rubbing it that you don't lift up any of the edges, because then it won't stick quite as well and you probably have to redo that bit. But just make sure it's nice and secure there. So there we go. That's what we're looking for. So it's really important before you even do it, like I mentioned earlier, make sure the person's sitting. If you do it with a straight leg, it won't work quite as well. And then when you get the person to stand up, so my head's going to get chopped off in this video, they should have what looks like a bit of a wrinkly knee. And that's essentially applying some upwards pressure, and also a bit of a pressure across, because we put that first one on. So we're sort of guiding the kneecap this way, which secures it a bit more. So now, if I did have patellofemoral joint pain and I went to go for a walk or go walking downstairs is usually quite sore, might feel a little bit better. In some cases, it does get rid of it completely. Some cases, it's just won't make much of a difference. It really is individual, unfortunately. But give it a try, see if it works for you. If it does, follow this video if you want to put it on in the future, and it can just help manage it while you're doing the exercises and getting better. So that concludes this video for taping for patellofemoral joint pain. The next one that I'm going to do is a little bit of an acupuncture session on tightness in the quads. It's less common to cause patellofemoral joint pain, but because we're looking at this VMO muscle here on the inside, sometimes that can get a bit tight. So we're going to look at a few things from an acupuncture point of view to tackle that. And it'll be a nice sort of video to follow along if you're a practitioner watching this, but then also if you're experiencing patellofemoral joint pain, it's just so you know what to expect really going into it. And if there's anything else you want me to cover in the future, please leave a comment below and I'll make a future video on it to help you. And I will see you in the next video. Thanks for watching, guys.